time you please tell also, please see.
Sorry?
They have to see.
Yeah.
Yes, time up.
The girls need to check, because it's very
Um,
all right.
Yes. So can we all quickly settle down at our seats so that we can resume our session? I request all the delegates to take their seats, please.
All right, well, it's my pleasure to introduce Dr. Ord. He's got a background as a pharmacist, and he started his career within various pharmaceutical industries, and then he moved in 2003 with the Schwabe Group. Sorry, that was in 2000, and since 2003 he's with the DHU, where he is currently the Director of Pharmacy and a qualified person. So we're very pleased to have you with us and to share some of the concerns that were also expressed by some of the doctors at the beginning around the availability of homeopathic medicines. Dr. Ord.
Yeah, thank you, Robert as chair, ladies and gentlemen, and all colleagues. It's an honor for me to be here. And I've heard India is a second home, but I think this is not true. I think India is a great home of the homeopathic family. So I want to tell you something about homeopathic medicines from a German and European perspective for sure. I can just tell about these aspects. And okay, as you know, we have an experience and expertise for over 151 years. So in 1865, the Homeopathic Central Office in Eastern Germany was founded. And in 2016, we are extremely glad that we could celebrate on our 150 years jubilee. And we are also proud that in the fifth generation, we are a family-run business. As you know, we could transport homeopathy in case of quality. In 1872, our founder of the company wrote the Pharmacopoeia Homeopathica Polyglottica, and was really important at this time, because also at this time quality was discussed as it was discussed today. And so he tried to find an agreement with English doctors, with French doctors, and so he made it together in this time. And I think such an idea could also be a big step forward in our times. We have heard it from a global approach to go in this way further. So, have you seen, you have heard about the European Pharmacopoeia. For us in Europe, it's really important to have these different traditions now together, as a work together, starting from the organon to the different, here in this case German or French or also Swiss traditions, to come to agreements. It's not easy, it's discussed and it's emotional, but I think we are really going forward in this discussion, and it's now for 10 years in this European sense working. Very important, as we discussed, are the medicinal products itself. And it starts all over from the cultivation. So cultivation itself is extremely important. So we have Terra Medica, and there we have a state-controlled certified organic agriculture for medicinal plant. No chemical fertilizers, no insecticides, no pesticides or herbicides, local pure groundwater and full self-electricity supply is delivered there. So it very starts from the beginning, from the plant. Also, as we said, manufacturing is crucial and very essential. So state-of-the-art manufacturing must be implemented. We do not differ from Roche or Novartis. That's clear. We have to bring to the patient the same quality. I say always to my fellows in the company, I want to have that you are producing products that I will give to my daughter and to my kids. That isn't allowed to be a difference at all. So, some common standards, we agree here in this room all to these common standards, it's clear, but sometimes it's discussed somewhere at different countries. We are also in 50 countries worldwide. We have also a deep insight. And so sometimes the simile principle is discussed, or sometimes materia medica is discussed, or sometimes the active pharmaceutical ingredient is discussed. But I think this shouldn't be discussions today, and this shouldn't be discussions anymore, because we have a clear view and a clear point of that. And homeopathic manufacturing is only according to principles laid down in an officially accepted pharmacopoeia, in context to the tradition, in context to the organon. And as we know, the API, the active pharmaceutical ingredient in homeopathy has nothing to do with a special extract or so. It's not a chemical. We want to have the pure material, the original material, no gene tech or something like that. So in such a plant, there are 2,000 ingredients. Where do we dare to pick one of these ingredients and say this should be related to quality at all? I think it's not the right way. So batch tracing must be from bottom up, from the raw material to the finished good. It's really a special achievement to have really for each finished product the complete batch tracing. We have to discard the complete potency row if the monograph is changing. We cannot adhere to the potency row. We have to renew it completely from the very start. And lifetime GMP documentation of API and the finished good must be implemented and must be ready for inspection, this biannual inspection you got from the competent authorities. And we shouldn't discuss pharmacovigilance. I think we are in a globalized world. Pharmacovigilance must, and also the complaints must according to international rules and to international standards. Plantations, I've given you some pictures from these good agricultural practices. RX is sometimes discussed in different countries around the world. I think this belongs to national rules, but there should be a clear commission who decides whether aconitum mother tinctures should be RX or not, according to the national rules laid down in some commissions, like also a national expert group in Germany who decides which product is RX or OTC. As I mentioned it, I think it's only needed if a special aspect is behind it, if toxicity has to be discovered for the safety of the patient and for special quality reasons. And sometimes there is also a mixture about stability. Stability shouldn't be discussed in the pharmacopoeia. Stability should be discussed in the dossier. We have stability concepts. We discussed it at the moment. It's a high emotional concept, but I think according to ICH rules, we have tools to find very sophisticated, very good concepts relating to bracketing and matrixing concepts. They are established, they are used in a globalized world. We have to find here special solutions. Also, the first homeopathic active pharmaceutical ingredient is, from my understanding, not the raw material, but the first concentrated homeopathic mother tincture, for example, or trituration or dilution thereof. So this is the first step. We are talking about API in homeopathy. And as also mentioned, there must be some measures against counterfeiting and also tamper-proof possibilities. But compared with some materials I got in the internet, yeah, we have to find solutions that it's not written in the paper and distributed elsewhere, but really that all comply to these necessities. So key features of homeopathic products, you know it all. It's a huge number of products. As I said, we have 1,350 APIs approximately. So sometimes we have small to very small sales numbers of this product. And we have very well-known substances for decades. We have good pharmacopoeias with general and substance monographs and with manufacturing instructions. So we have also some generic approaches to this well-known nature of substances. And we can really come to dossiers which have some generic instruments and have some special aspects of homeopathy in a really smart and sophisticated way. And from my point of view, the way we have chosen in Europe with a CTD format, with this common technical document, is not really the best final way. We have to improve it because this generic approach and these specialities for homeopathy are not adequate addressed. So here just a glimpse about our internal list made in the 70s before. 5,000 substances we got here, and we got it to the marketing authorization aspects. This was the very start, for example, in Germany. So 5,000 substances, approximately 800 pages. And so it developed, yeah. With this initial registration, we had approximately 20 years after this re-registration, and again 10 years after it, we had a renewal. And in 2010, we made such a referral aspect in Europe, and you see it's growing and growing and growing, the paperwork here. And I think there could be in the future better and smarter solutions, and obviously we have some lesson learned. There can be some reduction of the dossier, perhaps according to the substance itself, not to the dosage form or separated. We have also seen some other examples, and we can have also combined approaches appear most promising. Appropriate standards, and also some special rules. In Germany, we got the rule of 1,000. And in India, with this huge population, it could be perhaps a rule of 10,000 or so. But nevertheless, each finished dosage form you are bringing on the market must comply with the general rules and must be ready for inspection. Also, some additional information could be done in the future in more intelligent way. For example, it's natural that I should address the supplier. That's a must. We have to show for each batch which supplier was integrated. But nowadays, we could do it with a database which must be actualized from the pharmaceutical industry according to law. So just a look over Europe. As we have heard, in Switzerland, there are smart notification possibilities and registration processes. You have heard about this HAS list, also a good approach. We have heard about, not heard about Norway. Norway has said, okay, if in Europe is an official medicinal homeopathic product, then I accept that it's also distributed in Norway. In Germany, we have clever principles of marketing authorization with standard registration, rule of thousands, and so on. So also it's a mixture of it all, I would say. And as we will hear from the USA, there is a completely other system, direct access via a pharmacopoeia and relying to these general rules in the pharmacopoeia. So this European Common Technical Document, as I mentioned, I think it was just made for chemical substances at all. And so also with Italy, we have just to go again through and through this common technical document. And sometimes it looks quite funny because the same questions are coming up every time or every 10 years again. And I've mentioned the internet. What about quality in the internet? So as Professor Knöss said, the example in Germany is quite difficult with 4 more or less approaches, very sophisticated, but I think a good system at all. We have France, we have better expertise from Ms. Chetkuti, but I think in France it's also a good idea that I have the possibility for magistral preparations still. I mentioned the example in Switzerland, also some elements really interesting. Perhaps India has the pleasure to pick the best of all, to make really a best practice in the end. Yeah? And we mentioned the case stability testing. Yeah? It's clear also homeopathic preparations must have be stability, must have be an expiry date. We spend millions of euros each year to make stability studies, but it must be made in a sophisticated, in a special way relating to homeopathy, not to the normal chemical standard. Because when I'm doing just like Roche or Novartis is doing it, then I would have to test 350,000 times perhaps stabilities for the finished goods we are distributing alone in Germany. So this is no real clue for this, but I think according again to the international established guidelines, we got very good, sophisticated, smart solution for this homeopathic question. So lessons learned, just to wrap it up, materia medica, there should be a doctor's global list. The Liga can have here a prominent run on this. Sometimes in Germany we have discussions about this. Claims and efficacy. So also here the doctors should establish together with the pharmaceutical industry a list of traditional use and well-established use claims and general claims. Safety. Safety is prominent for each patient, that's clear. But also here we have a long-term, long-time experience over 200 years. I think we are knowing what we are doing. Nomenclature of homeopathy. Funny, I had half a year before with a member of the German parliament a discussion. Don't say Arnika, say Bergwohlverleih, the German name. Nobody will understand. Yeah, it's completely nonsense. Yeah, homeopathy has globalized names. We should stick to that. Yeah. Dosage can be tricky. Perhaps it should stay on a national level. Yeah, we have general rules for dosage forms, but nevertheless, from my opinion, there can be still again national rules to the national local traditions. Manufacturing methods and quality must be in the pharmacopoeia and the current GMP rules. I personally would not differ between homeopathy and allopathy. We have to make the best effort ever for our patients, for our children. And analytics, according to pharmacopoeial monograph, our point of view is just it makes sense due to toxic reasons and to some special detected quality reasons, but in other cases due to this broad matrix and due to the standardized manufacturing methods, I think we shouldn't detect surrogates. It's not scientific use in the end. Discussion of how to reach a good generic document approach. I think this should be going on also in Europe. And suppliers should be named, but could be done in a more sophisticated way. And also the good distribution process. You know, it not all ends with a factory, but various pharmacies and the client who got the final medicinal product in his hands must be also cared of. So from my point of view, homeopathy could be easy, just use common sense and our tradition and our experience. We have here it all, yeah, over decades, and we have good rules. We have just to gather these good rules and to find for the future the best solutions at all. So thank you very much.
Thank you very much for such a good overview, and it is quite an amazing thing to know that there is more than 100 years of experience with the regulation of homeopathic medicine. So that is quite amazing that you're in a position to share some of that with us. We're going to move on to our next presenter, which will be Christian Moll. He is the General Secretary of HAMPS, which is the European Coalition of Homeopathic and Anthroposophical Manufacturing Companies. And he's got a background nationally as from Ethiopia and Holland, which is already quite interesting. But then if we look at the background of his career, he's moved from pharmacy to homeopathy to anthroposophical medicine, which I think is also quite interesting and broad. And now he is going to share with us some of his views and visions about how we can look from a strategic perspective at governance of standards for homeopathic medicinal products. Thank you very much.
Thank you very much, Robert, for your introduction. Late in the afternoon, dear colleagues and friends of homeopathy, dear Ministry of Ayush, dear Central Council for Research in Homeopathy, and dear India, for me, it's a real honor to be here today and to be allowed to speak. I am Christian Moll, as Robert said, General Secretary of the only association specialized to represent and develop the interests of the homeopathic and anthroposophic industries in the European Union. So let me give you an overview of our association. Our mission is to enable the presence of products for the demand by prescribers, for the demand of the general public. We favor a well-balanced governance of the sector, of course. We advocate for it. And just a clarification, we have anthroposophic medicinal products in the title because a very big part of them do comply with the European definition of homeopathic medicinal product. So this is a clarification. This is why you find them in the name. As you see, we have quite a lot of members in 18 member states, 45 companies, and we have associated members which are industry associations, and we have also corresponding members which are health professional organizations. So it's quite a network, and it's very Also an honor to be General Secretary there. So, homeopathic and anthroposophic medicinal products, they are a treasure. They are a treasure for all of us. They are a treasure in particular, this has been said several times, for patients. And these patients require from us professional enthusiasm. Prescribers, pharmacists, industry, regulators, all you together, all we together today. So we are somehow called to be enthusiastic and professional. So this is reflected in generating standards that allow this reality, this treasure, to exist. Standards have a role in protecting public health, nihil non nocere, that's the general principle. First of all, do not harm. And then, of course, granting a high quality availability. This high quality issue has been mentioned a lot of times today, and this is perfectly the case, and we take that with us. So, sustainable standards. So, I've had some reflections on standards. It was a seminar at the Hertie School of Governance in Berlin, and we talked a lot about society governance and things like this, and a couple of things became clearer to me, and I'm very grateful that I can share them with you today. A standard is something that develops. You can look at it in different ways, but you can look at it as developing between state needs, state actorship, market actorship, and users' perspectives. So this is a tensed field. And I use this triangle. It's slightly adapted, but it's generally a triangle used in sociology, so-called welfare triangle. You will find this in all sociologic literature. So, slightly adapted for sustainable standards. So this is the field of tension where standard develops in. Now, you can think of fallacies. What can happen in this triangle? There could be, for example, too much market, companies only interested in profit and no quality. This is one fallacy you can have in this corner where the market actors are. Or too little market, market failure, no products available, perhaps due to high costs, that this has been mentioned today again. You can have a fallacy in the corner of the patients, the users. Is there sufficient information? The information issue was mentioned as well. Is there enough knowledge to discern the products? That's a possible fallacy in that corner. Of course, there are fallacies with the state actors as well. There could be too little regulation, and that would be a threat to public health. We know that the whole pharmaceutical regulation came into being because of that horrible scandal and tragedy in the 60s. There can be over-regulation. That means too much regulation causing state failure, too high costs, black market, or favoring even a monopolist industry, only one who copes with that over-regulated standard. So these are possible fallacies around around standards. So now I want to give you a detail on the reality of homeopathic and economic data, which also today has been mentioned. Now, we did a survey 2015 amongst our members, and we asked them, well, tell me what are your high margin products, what are your medium margin products, and your low margin products. And we then made an arithmetic average. And it's quite striking to see that a minority of products is high profit margin, and the majority is of low or non-profit margin. And this is a reality, a typical reality of our sector. This is an average. It doesn't count for every company in the same way. It's an average. But this is a reality of our sector. We feel committed to the availability, but the products have a total different economic status. So this is something we have to know about our sector. This is a basic information if we rule the sector, because there can be two failures, market failure or state failure. That's a tricky thing that is possible in our sector. So, my positive statement is that fallacies and failures can be minimized by a sustainable standard that manages to get into the triangle of tensions in a sustainable way. So, a sustainable standard is also legitimate. It is considered as legitimate. And I would like to go a little bit more into this legitimacy thing. Standards are often worked out in, let's say, in a little bit lower than the